At this time, we'd like to welcome you all to Southbury's Economic Development COVID-19 webinar series. Continuing today, our topic is health and safety concerns for businesses during COVID-19. And our special guest today is Neil Lustig, our Director of Health for the Pomperaug Health District. I do want to start by telling you a little bit about Neil while he gets settled in. Neil is, as I said, the Director of Health for the Pomperaug Health District, Department of Health, PDDH. It's headquartered here, I'm happy to say, in Southbury, and has been since, he's been in this role since 1988. In this role, he leads a multi-town regional public health entity. He oversees the health and safety of the district's 3 communities, which are Woodbury, Oxford, and Southbury. He's responsible for the enforcement of Connecticut's public health code requirements and food service inspections, subsurface sewage disposal, and infectious disease control. He prepares and administers the annual budget for the PDDH, establishes their policies, serves as liaison in relationship with the Board of Health and town elected officials. In addition, he coordinates many community health programs, including cancer screenings, etc. And in this case, emergency preparedness planning, which is a key concern. Prior to leading the PDDH, Neil served as Director of Health for the Clinton Health Department in Clinton, Connecticut, and prior to that, he was with the Health Department in the city of Stamford. And with that, I would like to welcome him, and then I will then say why we are talking about this particular topic. Hello, Neil. Good to have you with us.
Can you all see me?
We can all see you, and as I was telling everybody, you can choose speaker view if you wish, which lets you see more of Neil and his very busy office. Hey, before we dive in with this, Neil, let me just do this. I'd like to just say why we are talking about this topic. It should be obvious, but we did hold a impact survey. The Economic Development Commission put out a survey for a month to the businesses of Southbury. And in this impact survey, not surprisingly, over half, over 50% of the businesses that took the survey stated that health and safety issues for their employees and their customers were a concern. I want to share one other thing. This kind of piggybacks on our conversation last week that we had with Ron Carucci. In his most recent article in Forbes, he noted that the PwC survey of 1,100 workers found that 70% of workers say that there are factors that would prevent them from wanting to return to work, and 51% cited fear of getting sick as their major worry. So with that, I want to bring it back to Neil. And Neil, I think just as a start, I just wanted to ask you, have you ever in your career that we've just articulated seen anything like this?
No. We went through the Oxford anthrax case in 2001, right after 9/11, which was a whole bunch of hoopla and a lot of CDC and federal people running around, but it was kind of over in about a month. This appears to have no end. It just goes on and on and on. And now we're getting into the will schools reopen, will they not phase, which impacts a lot of people in Southbury. A lot of people have children in the school system.
Sure, and we'll get to that and definitely talk about it because it's obviously on everybody's minds. So just to, not everybody gets the opportunity as I do to chat as often as I do with you and get to understand the role the health district plays. But if you could lay out for our listener, what is the role of the health district for these communities, and then also describe how it interacts with the state. And with, of course, what everyone hears about the most is the CDC, which just seems to be the authority on high. So just explain that relationship and how.
That's a question that could take several hours to answer.
Okay, so I guess the crib notes.
I'll try to do it in 5 minutes. I'll do my best. So health districts are formed under Connecticut statutes. The statutes were passed in 1965. There were 20 health districts in Connecticut. We are a 3-town health district. We're probably in one of the smaller ones, population-wise. We carry out what they now call the 10 essential services, which includes the Connecticut Public Health Code, but that's only one of the services. It includes making sure that the health of the community is taken care of. It's the follow-up of infectious diseases. It's all the environmental health enforcement, which is pretty extensive in this area because there's not much public sewer, so we do all the septic systems. A lot of people on private wells, we do all of that. We do the beaches, we do the swimming areas, we do all the nail salons, all the hair salons. We inspect all the restaurants, the caterers, and take public health complaints. We approve every single building addition, every single pool, every single in-ground pool, of which we have about 100 of them in the last 3 months. We see the stay-at-home crowd very strong. We promote good health. We have diabetes self-management programs, fall prevention programs for the seniors. We do blood pressure control programs. We do over 3,000 vaccinations a year, including 2,500 flu vaccinations. There's a whole lot going on here. We carry out the Connecticut Health Code. We take general direction from the State Department of Public Health, but it's only general. They do not oversee us. The only real control they have over the Pomperaug Health District is they can remove the health director for cause if they're unhappy with us. And
well, that hasn't happened in a while.
No, they've only done 1 or 2 in the last 40 years.
Okay.
Otherwise, it's a general cordial relationship, professional relationship. We communicate with CDC only through conference calls, memos, guidance documents, and they're the ones who directly converse with the State Department of Public Health, and that's how the state and local health department system is set up. So it's federal, state, local in the United States. Most states have county health departments and some regional county health departments. Connecticut has no real counties, so it has regional health departments. Generally speaking, there's only 2 regional governmental entities in Connecticut, which is school systems like Region 15 and regional health departments like the Pomperaug Health District. There might be a few others that are kind of quasi-regional. I think we have a great relationship. I have a board of health with 5 members appointed from the 3 towns. They're an elective body. So the town appoints the members provide guidance, approve ordinances. We can pass our own public health regulations, our own fee schedules, and they take guidance from the selectmen of the towns in this case, or the selectmen just come to me directly, which is kind of how it works in the real world. And I think I have a very good relationship with my 3 first selectmen, especially Mr. Manville in Southbury, right, Jeff?
Absolutely.
Okay, we get along really well from the beginning. I think we think philosophically pretty much in the same place, more or less. So we do all of that and 2,500 flu shots, and we're deep in flu shot planning. We're about to hire a public health nurse. Our nurse is retiring. We are only 6 full-time people and a couple of part-time people, so that's really a big deal for us.
It is.
Major component of our community health program that interfaces with the senior centers and others. We follow up reportable diseases. So there's a vast cadre of infectious reportable diseases in Connecticut. Lyme disease, measles and mumps, tuberculosis, chlamydia, okay? All kinds of sexually transmitted diseases on the list. And then the most recent disease added to the list in Connecticut is COVID-19 disease, which was added in March. So bring us into that. So we've been involved in that planning since late January and February. We are deep in that now. And we're now in our early stages of COVID-19 vaccine planning. More good news today, which sent Wall Street into orbit again this morning about a vaccine is coming. So the feds are into $15 billion in vaccine development, at least $15 billion. And they're moving along through their clinical trials. We could talk about them in a minute, but Wall Street's buying into it. The Wall Street really thinks that the vaccine's coming, and that's going to be the fix, the ultimate fix for the COVID-19 disease. And the Pomperaug Health District never left community vaccinations. We are mass immunizers, and we will do what we have to do, assuming we can get volunteers to help us. So, and we will be making a plea for volunteers. Some of our older retired nurses that we use in our flu clinics are having reluctance to work in a flu clinic or any vaccine clinic where they're exposed to people now. That's an issue for us. So we need volunteers who will step up to the plate, of course, with full PPE and things like that.
On that note, Neil, if I may, on that note about volunteerism, just because I don't want to forget it, we're going to be providing contact information for your office at the end of this webinar. Is it safe to say that if somebody's interested in serving in this way and being a volunteer, that they should reach out to your office?
Absolutely.
Great.
Okay. We don't need any more contact tracers. We have 4 for the Pomperaug Health District. We contact the people, we call them, we advise them on quarantine and isolation. We do have cases of COVID-19 in the Pomperaug Health District and in Southbury, Connecticut. It is not nearly as many as it was in March and April, many of which came out of nursing homes, especially in Southbury, which is more or less one of the nursing home capitals of the state of Connecticut by population. We have more just general population COVID-19. It could be a 19-year-old, could be a 23-year-old, could be a 33-year-old, could be a 50-year-old, and we still get 1 or 2 out of the Hearth or other nursing homes in Southbury. 3 to 6 a week is a number for you. We follow up all of them. We find out where their contacts, where they're in the state system, and we are the contact tracers.
On that note, Neil, you are deep in the data, of course, and like I said, I think you have a health call with the state. What is it, every Monday?
It's now Wednesday. It's now at 1 o'clock.
Oh, okay. So we have a hard out at 1 o'clock.
That is a hard out. We have that call.
So you touched on it, but just give us a little clearer picture. Where does Southbury sort of fall in line with the state? How are we doing? And you can also speak broadly about the district.
Yeah, Southbury is pretty much like the rest of the district, except Southbury had 4 nursing homes and a large assisted living. So Southbury got hit pretty hard with when it swept through the nursing homes from mid-March to, let's say, mid-May or May 1st. There were quite a few deaths in one of the nursing homes and others in some of the other nursing homes, and quite a few cases coming out of 1 or 2 of the nursing homes. It's all managed now. It's all under control. They've done a really good job of that. We see, it's really now a case now and then. The nursing homes are testing all their staff every 14 days. So some of that is picking up from the staff, and then some from the patients, but it's very sporadic. It is very, very sporadic, almost not reported. What we are seeing is this occasional case of, like I said, a 19-year-old, a 24-year-old, a 30-year-old, 23-year-old going off to law school who lives in Southbury. Where are they all getting it? Well, so far, most of them are getting it from Arizona, Myrtle Beach, Florida, Texas.
So you're saying that the cases we're seeing of these younger aged folks are more likely or most likely seem to be coming in from having traveled to other states where
that's what we see, and that's why, just looking at our little perspective of 1 or 2% of the state population, that's why the governor is all over this quarantining, and he's got a list of 22 states, and you're supposed to stay home. And I think yesterday he said, and you have to register on a state website that they haven't created yet, put your name and address and phone number in if you've come in from another state, because they're seeing the same data we're seeing. Right. They're seeing the sporadic cases coming really from travel, coming in from these hotspots. We're seeing it. And it's mostly younger people going to these hotspots for vacations, for parties. We're going to bars. There's nothing open here, so they got to go down there. And and they bring it back with them. It's almost a given that they will. What we really look for in all of this is that when you hear that word community transmission, and that's in all the state school plans. So as these schools, like Region 15 is working on school plans, there's these guidelines about when a school would close that are still being developed. The state is very mum, but the general guidelines say now, if there's cases in the area, if there's evidence of community transmission in the area, they don't define what the area means. Is the area the whole state of Connecticut? Is it Waterbury? Is it Southbury? Is it Western Connecticut? What is the area? So we see our immediate area. I cannot see cases in Newtown or Waterbury. I cannot see cases in Torrington, but I can see our immediate area. And I can say right now, we don't have evidence of community transmission in the Pomperaug Health District. Yet we have these cases. There were 3 last night. A 19-year-old, a 50-year-old, and a 90-year-old out of the hearth. So this is the kind of, then we might have a day where there's nothing, and then there's another case pops in. That they get tested, and then we get the results. We contact them, we call them, we talk to them about quarantine and isolation. We see it go through families. So one family member gets it, and then the wife gets it, and then the kids get it. We've seen that. It's rare, but we have a couple of that. So yes, we do have records now of about the youngest is maybe a 12-year-old, 12 and 14, 15-year-olds get COVID-19, which is an issue for the school systems come September. Yes, they get it. Okay, not a lot, but they get it. And it's usually not severe. It might just be some sniffles, light disease, sometimes nothing, they're just asymptomatic. A lot of testing going on in Connecticut now. Testing. You hear that? Sure. CVS has got 28 pharmacies. The hospitals are all testing. You see signs on the highway. Testing. Of course, they're not telling you that Quest now takes 10 days to get your results. Oh, we forgot to tell you that. And that's an issue that no one's talking about.
What about the
other labs are faster, but Quest is really bad.
On the subject of testing, Neil, what's the sort of the latest on this idea that there can be, the swab test or the home test, or something that doesn't take as long as you're saying this does?
I don't know enough about it. I will say, anecdotally, it appears that a lot of the healthcare systems have turned away from that super rapid test called the Abbott test, that 30-minute test.
Yeah.
It is used extensively in emergency rooms and hospitals. Someone comes into emergency room, they kind of have to know. They send them to the COVID wing of the emergency room or the regular emergency room. Same for the hospital.
This is Jeff.
Hi, Jeff.
Unfortunately, I'm being called away from the webinar. I just didn't want to just drop off. And this is recorded, so I'll be back on to take a look at it.
Okay.
Thank you. I'm sorry, they're calling me for something.
Okay, Jeff. Thank you.
Thank you.
Okay, Neil. So obviously on the topic we're on right now, it does beg the question, and maybe it's too broad, too loaded, whatever you want to say. Should people feel safe?
With 1 case or 2 cases a day at most out of 50,000 people, yeah. That's not a lot of cases. It really is. It's an attack rate of infinitesimally small size. The seniors in Southbury, the Heritage Villagers, the seniors in Southbury, Heritage Village, my other towns, the Greens in Oxford, we see like nothing coming out of there. They've done a really good job. Connecticut's done a pretty good job in social distancing and masking and hunkering down and staying away from group settings and parties, bars, which has big implications in Florida and the Carolinas and Myrtle Beach. Texas, it seems everything's coming out of bars, okay? If you avoid bars, you're probably in good shape, okay? And so the answer is you should feel safe with precautions.
And precautions, I guess, are the name of the game. One of the things that has been, I know it's been challenging for your office, but it's been challenging for all of our certainly all of our business community, has been the changing guidelines. Mm-hmm. I imagine it's been an enormous thing for you to keep up with in terms of not only following protocol, but also implementing it. I know for me, especially the first few months, it was pretty much a daily information stream out to the business community of changes and everything new that was happening as we got closer to these phase 1, phase 2, and then now anticipate phase 3 being on hold. Can you just talk a little bit about just that, the challenges, not only for your office, but again, and I would say more of an empathetic view, I'd say, of for these businesses trying to navigate this moving target?
It's extremely difficult for all the parties involved. I mean, I have spent almost every weekend reading guidance documents. That's all I do. 47-page school guidance document. The 30-page American Academy of Pediatrics document. The closing Connecticut documents, and now the reopening Connecticut documents put out by the state for salons, for restaurants, for groups, for graduation ceremonies. And now just an endless slew of documents on school reopening.
Sure.
In 15 was summer school reopening, and now it's starting with the regular school reopening and what it'll look like and who's involved. CDC documents, and now they're starting with the COVID-19 vaccine planning documents. They sent out like a dozen the other day. Just read these and digest them. Some of them are only 8 pages. Some of them are 48 pages. How can any human actually, I mean, there might be some people, but how could any human consume all of that and retain all of that?
Right.
Massive information overload. And I have a staff, and I delegate it out, and they delegate it back, and then I delegate it back, and then they, well, you read it, you know, like, okay, it goes back and forth. We tried from a practical point of view. I made it sure that the Pomperaug Health District would not become the COVID-19 police force for the town of Southbury.
Yeah, go into that a little bit further, because I know
Yeah,
this is something you've been adamant about.
It would take us down rodent holes, and we would cease to see the bigger picture. Yes, people call up and they complain about a restaurant. They're not wearing masks. We call the restaurant and tell them we got a complaint. They don't have this. The tables are too close together. I measured them. They're 4 feet 9 inches instead of 6 feet. Okay. 2 of the serving staff weren't wearing. They had a religious event at Heritage Inn, and they had hundreds of people. Nobody was wearing masks. Some of those are more alarming than others.
Sure.
And hair salons, we haven't gotten that many. We get a couple a week. And we really have not become the COVID police. We try not to, my staff comes to me and like, do we need to go out on this? No, you need to call them and tell them you got a complaint, and they should up their game and make sure the staff is wearing masks. Sure. But we're not going there and doing, forensic investigations and staking out restaurants in the town of Southbury to see if that's really true. I think I brought up last weekend, well, maybe one of you want to go out on Saturday and see if this is true. And that didn't get over really big. Okay. That's like, we're not the COVID police force.
Right.
Okay. And of course, we've got complaints that don't involve places we regulate, and we turn them over to the COVID police officer of the town of Southbury, who there isn't any. Okay. And it's just some of the issues that go on here. But we are focusing on vaccinations. We are focusing on working with the schools. That we are not running from.
Of course.
Okay. So that's kind of decisions that I made internally to kind of lay off the businesses and just call them if we got complaints. We're not inspecting every business on Main Street on a routine basis. But focus on the priority, which would be like schools, nursing homes, assisted living, and vaccine planning. There will be a COVID-19 vaccine.
Yeah, I think that it's a matter of resources. It's simply that you, as you mentioned, you have 6 people, and certainly a team of volunteers could use more, but there just simply isn't the manpower and resources, and it has to be allocated appropriately to where it's most important.
Yeah, and then you'll run into some people we regulate who might not like us coming by. They're out there. I call them the anti-maskers. The maskers and the anti-maskers. Okay? So the maskers are compliant. They follow the rules. They do what they have to do. They tell their employees to follow the rules. And then the anti-maskers were like, there are no rules applied to us. I resent them, and we're going to make political statements by not wearing a mask. Okay? And we have them out there. We have them in our towns. We have them in Woodbury. I actually got a lawyer letter about in May. So some little place hired a lawyer and sent us, where is your authority to demand this? Like this five questions. Like, where's your statutory authority? Always what's going on and on. We didn't even waste the time responding to that kind of stuff. Okay? Because
Right.
it's a rat hole. We're going to spend 8 hours responding. Why? Okay? I'm not a constitutional lawyer. I'm not going to start citing. Does the governor have the power to throw out the Constitution of the state of Connecticut? Does the governor have the power to make these rules, change them on a dime, institute new rules, institute quarantines, institute lockdowns, force schools to open, force schools to close? I don't know, and I'm not going there. Thank you.
Sure. No, that makes sense. Let's focusing in on businesses. What recommendations would you have, Neil, for the people running their businesses, the owners, the managers? We spoke about this last week on our call when we were focused on sort of the mental health of people and making people feel comfortable from a emotional side of coming back to work and coming in and being customers and clients. But with my conversation with you, I want to focus on the same kind of idea, but what can we do to make people feel safe to come back into the workplace and make these employees feel comfortable coming back? Because not everybody that is saying who's being asked to come back to work and is saying no, I don't want you to feel safe. Not all of them, as many people would like to say, are saying no because of the extra pandemic insurance, which may or may not be running out. There are people that legitimately just do not feel safe. So what guidance would you give there to the business owners, business managers, on those two things? How to make people feel safe, legitimately, and then frankly, if there are conditions that warrant it, what are they that somebody would, should not come back because of somebody at home or something like that?
From what we see across the health district, most business operations are really doing a very good job in following the principles of social distancing, masking of patrons and of the staff, and the separations. We see that all over the place in the 3 towns. Really good compliance. And yeah, there's going to be a complaint now and then. It's inevitable. Very, very low cases, as you asked before. So at least in this immediate area, we just don't see any, with some basic social distancing and basic protection, we don't see that it's an unsafe environment. And we would tell anybody that. That's subject to change. There's no evidence that it's changing.
Right.
All right. Okay. And you realize since March with the COVID-19, does Southbury have a big healthcare system? There are a lot of people working in healthcare in Southbury. So your first gut instinct is, well, there's no hospital here. So no, wrong. It's actually the opposite. There's a huge amount of people in Southbury, Connecticut working in healthcare, and there's just or larger huge amount of people who work in healthcare somewhere else. And that's a very strong part of the economic component. So we have 2 major healthcare centers, Waterbury Hospital and Nuvance on the corner of Old Waterbury Road. We have 4 nursing homes and assisted living. And those nursing home facilities have independent living on top of the nursing home, like a mid-level area. Right. In the Mopprog Woods, East Hill Woods. It's among the largest nursing homes in the state of Connecticut, River Glen and Lutheran Home. They are healthcare systems. They have doctors. They have lots of nurses. They have CNAs. Mm-hmm. They're a regular hospital, literally, and you realize that. And then we have the private doctors who are everywhere on Main Street in all 3 towns, and Southbury especially. And then we have the urgent visit and the walk-in. Right. Physician One in Southbury have become the swabbing kings of the state of Connecticut. I'm not making that up. They're up there at least equal, up there with CVS and 28. They're just huge. Not
Mhm.
only here in Southbury, but the drive up swabbing, they do at all 16 of their places in Connecticut and 15 more in New York and Massachusetts. They're massive. They have it down to a science. And then you got the dentists. So when we started to get PPE, some modest amounts of PPE from the state in these weekly deliveries, which are
Yes.
pretty much winding out,
They
the
have. Yes.
dentists were all over me. The dentist can't buy it. Here's my dentist. Yesterday, I went to get a cleaning. First time for me, he opened up in June. And here is a 3M 8. His secretary gave me it yesterday when I was waiting. Here's a 3M 1860 genuine N95 mask.
Yes.
$9.95 a mask, and you must order 100. You have to drop $1,000 to get these for a dentist practice. $1,000, $10 a piece.
And that was because the N95s were considered mandatory for that particular business.
Yeah, they've been, well, to get the PPE is extremely difficult to get. And to get quality name brand PPE that's not a counterfeit is very, very difficult to get. But you can buy it from this dental company for $10 each if you drop at least 100 up to $1,000.
Now, what about on the N95? I remember when that edict came out and we were looking at that, and I was asking you back then. People were looking for them to be fitted. A lot of requests came in for, how do I get my N95 fitting done? And there was few and far between places
I'm not
that you could
touching
do that.
one. That is an open-ended question that just rolls around now for years and rolls around in this epidemic. I'm not touching it. There's some OSHA, NIOSH requirements that say people in risky environments should be fitted.
I see.
And then you have to have special people. They do fit testing and they put some odorizing substance. And then if you smell it, then it's obviously not it's somehow leaking in. It's not fitted properly.
Right.
Okay?
Yeah, and I remember there was a place.
Then you get into the extra small, medium, and large masks. You can't buy them anywhere for any price. Okay? They do not exist. N95s. You might, if you want to drop $10 a piece, get a uni size, a one size fits all.
Mhm.
So that's kind of the issue that goes on. We have some N95s that were pre-COVID that we had in our stockpile. We've been giving them out to the healthcare system, especially dentists. I give them out 2 at a time. They're very grateful.
Absolutely.
Okay, they're very, very grateful. You can wear a surgical mask. They much rather have an N95.
Mm-hmm.
Like no protection and then 95% protection. So sounds like 95% is a lot better to me.
So before we leave this topic of making employees and making their clients feel safe, Neil, is there anything in the current guidance that's out there for the businesses that you would say, besides the things that are all listed there to do, to self-certify, to be ready to open, but what would you say, in your professional opinion, are the musts, let's say, and then even more so, what I would love to see Southbury become, and I think we're well on our way, is saying to the world at large, the state at large, we are the exemplary community. Come to Southbury. It's a great place, but it's also a safe place. So, what would is there things that you would recommend, let's say, to businesses and business owners that go above and beyond that you don't think are just a waste of time?
I don't know. We kind of follow state guidance. They had a level 3 guidance, number 3, which they were supposed to carry out by the middle of the summer, which is now. The governor keeps putting that off. That was that larger groups and bars and things. They said they were going to approve it if the data kept getting better. The data did keep getting better. In fact, it's superb, but they changed their own guidance.
Okay.
Just get the record straight here. They changed their own guidance out of fear that Connecticut would look like Florida or Texas. Okay? if they started allowing mass gatherings with
Okay, so you're referring
loud
to,
people yelling and drinking.
assembly, essentially. Yeah.
Yeah. They pulled their own guidance on that, their own guidance. And I think the environment is very safe. I have to add something about business, what's going on in business. We have business people on the call, or is it just?
Predominantly, we have business and nonprofit folks on the call. Yeah.
So what's going on in the growth environment? Remember, we do all the septic systems, we do all the water supplies.
Mhm.
We see everything before other people see it. We're having the most incredibly busy spring now into summer that we've ever had. Probably rivaling 2005 and 6 with the peak building boom. Not quite as many new houses, nothing like that, but we're just seeing massive faxing and emailing of septic system as-builts, massive property turnovers, some commercial development.
Mhm.
And it's clear, and there's been articles in the last week or two in the Times and the Journal and maybe NBC Connecticut. It's clear that there's two things going on that are driving this. One is the stay-at-home crowd, because it's unsafe out there. So I'll put my gazebo in, I'll put my deck in, I'll put my above-ground pool.
Sure.
You can't get an above-ground pool now. If you wanted one, you'd have to find a company, and then maybe they can put it in next June if you pay them now. It's that bad, okay? These are above-ground pools, nothing special, okay?
Right.
And we've done about 80 of them since March, maybe 100, okay, in the 3 towns. So you got the stay-at-home crowd mixing it up with the escape from New York crowd. And they're everywhere. And is it rhetoric in the Wall Street Journal, the New York Times? They have some moving data and anecdotal data. But I was on the phone with a guy this morning from Woodbury. Nice guy. We hung up his deck. We wanted to know where it was. We got it approved. It was 8 days or something. And I said, "Do you moving to Woodbury?" He says, "No, I own the house in Woodbury on Owl Ridge Road." I said, "So where do you live?" He says, "Oh, well, that's my summer house, my winter house. I have an apartment in Manhattan on 63rd Street and 3rd Avenue or something." Basically, he's escaping from New York. He says, "I go into the city like one day a month."
Sure.
He don't want to go there. And we got into that. And we're seeing that. We're seeing our applications, buying homes, remodeling their homes. I think that's a real positive thing for the business community because it brings money into the towns, into the town of Southbury.
Absolutely.
And not a whole lot of places to spend money in Woodbury. There's more places to spend money in Southbury because of the, let's put it this way, the pro-business environment. Compared to Woodbury, it's very pro-business. And Oxford's very pro-business too.
Sure.
And what we're seeing, and he says he spends most of his time up here in Woodbury. He loves the community, loves Southbury, loves the area. And that's just one guy I ferreted out this morning because he was complaining why he had to wait for his deck to take so long. But that's how you find out about people. And he considers now, he's an attorney, 58 years old. He considers New York City changing radically. It is no longer safe. And there are closed up businesses. There are looted businesses that are just boarded up right there in the Manhattan. And he doesn't want to be there anymore unless he really has to be there. And that's going on throughout the state of Connecticut, whether it's the shoreline areas up where I live, or whether it's up here in upper New Haven County into Litchfield County. They're coming up here. And so I call it the escape from New York crowd. But it's really happening.
It's really happening. Absolutely.
And
Yeah.
part of all that faxing of all those as-built were all part of house sales and house closings. So you need all that information. And that was all part of how our role in all of that, resales of houses. They have to know where the septic system is. They have to know the yield of the well,
Sure.
stuff like that. When it was installed, and we were the keeper of all those records. So that's a very positive thing for the business environment, as I see it. maybe you're the economic guy, you can figure out what that means. But if they're moving up here or spending a lot of time up here, then they're going to be spending money up here.
Exactly. I mean, we've had a lot of conversations about finances and cash flow, that sort of thing. And one thing I'm trying to say to as many people as I can is hang in there. If you need more lifelines and things of that nature, I can help find them for you, things to apply for. But hang in there, because it will come back. Things obviously are looking different. It may never be exactly the way it was, but I think that we will, in the long run, Southbury is going to do well. And some aren't going to be able to hang on, and we already have lost some businesses. But in counter to that, I do have new businesses starting, as many as one a week. So that is encouraging. So there is development. There's certainly a mass real estate movement going on to Connecticut. An escape from urbanism to perhaps more of a suburbanism that's going to happen, which is a kind of a flip to the trend that had been happening pre-COVID. And I think it's going to bode us well here in Southbury. I don't want to keep you right up to the hour, because I know you got your 1 o'clock, and I do want to open it up to our
health meeting
audience. Yeah. So for those that are on the call, if you want to just use your chat button, or you can just unmute and speak. If you want to chime in with a question in the last couple minutes we have here, I do want to start with one.
For 10 minutes, so.
Okay. We did have a question asking, are shots open to everyone in town if they work here and do not live here? And should institutions of worship continue contact tracing? So we have a couple questions in that chat.
We run a vaccine program for all vaccines. We still do it. We do it in the parking lot at 77 Main Street North. My nurse actually goes out there with her face shield and her N95 and her gown, and we give people shots in their car. We take some insurances, and it's available to anyone. There's no residency restriction.
Is that by appointment, Neil? You contact the office to make an appointment?
And in fact, our flu clinics, this is a problem with the planning. Our flu clinics this fall, which were really popular in October at the senior centers and here at our office, we have to use social distancing now. We have to do everything by appointment. We cannot have 200 people show up at 3:30 in the afternoon. It can't do that anymore. We're not going to be party to that. We're not going to allow that. The last thing I need is some community outbreak at a flu clinic. Okay? And you can read about that in the New York Times. That's not going to happen. Okay? And all by appointment. We're not scheduling that now, but if they call the office, we are doing adult vaccinations and childhood vaccinations by appointment. Okay. As for the House of Religious,
right, institutions of worship,
I wasn't aware of the contact tracing at churches and synagogues going on. That's something that's new to me. Okay.
Yeah, we do.
I don't want to touch that one, because I wasn't aware of that.
Okay, yeah, we do have some folks on the line from houses of worship, so I'm sure they were interested in these topics. It's obviously been a concern, and how to open quickly, how much contact people can have. Obviously, we're doing the outdoor church for a while, and now that doors are opening, how can everyone stay safe? One of the things I've seen. As we talk about just the differences between our country and the rest of the world, and places that have been able to mitigate some of these challenges of COVID-19, one of the things I see is that, obviously in America, we are the land of the free. It's like telling people what to do is kind of not really in our nature, what we're all about, where a lot of these countries where they really have been able to get a handle on this, and they've been able to, institute sort of sweeping orders. You will comply, you will do this. And it makes a big difference. You look at a place like Hong Kong or some other places that really could have had minimal cases, even though they had millions and millions and millions of people. But some of the things that they put in place are like, the technology of infrared thermometering testing. I mean, if resources were to be available, say from FEMA or other sources, let's just take public buildings, for example, and as you walk in the door, you're scanned, your temperature's scanned. those are the kinds of sort of technical, and then just simply, hand sanitizing stations everywhere in different spots in town and at entrances to buildings. Do you see those kinds of things being something that could make a difference?
Maybe temperature scanning with a hand device, but not, I don't know how well it would work if you had optical temperature scanning with cameras entering Southbury Town Hall or a church on Sunday morning. I don't know how well that would work. I don't think it would work very well. The anti-maskers would really come out on that one.
I guess I think about, when you're driving down the road and the speed thing tells you, you're going, it's a 30 and it says, you're going 38 and, it doesn't really do anything other than just say, hey, by the way, you're going fast.
The next generation might say, Mr. Smith, we've recorded your license plate and you're doing 69 miles an hour in a 40 zone. And if you do this again, we're going to give you a ticket. Then you're in a new level now, a new place. Okay, which we generally don't do in this country.
Right.
Generally. All right.
So Neil, just to kind of go out on a high note, I like to, in fact, I should call the whole series the glass half full.
Yeah.
So what's the silver lining in all this? What are we gonna learn from coming through this? And especially since you've been through some emergencies in your career, nothing quite like COVID, but you certainly have been through your share. What is that silver lining? What could we learn from this?
That's a tough answer to question. The Pompano Health District, myself and my staff, we're exhausted from this. It's now started in, let's say, March 1st.
Mm-hmm.
We're in our 5th month of this never-ending thing. So I'd have to give that kind of question a lot of thought. I think the state seems to be doing pretty well. If you look at the rest of the United States and other places in the world, Connecticut is down. What did they report yesterday? 20 cases.
Yeah.
Over the weekend, there was 66 cases a day. Thousands of tests. So Connecticut has done very, very well. There will be a vaccine, I believe. And so the end is near. I can't tell you when that is, but I believe the end is near. Near could be 3 months away, 6 months away.
Right.
All right. I think the world's going to have trouble getting back to normal. People won't know what to do. They won't know who to trust. They won't know whether they should get on an airplane or go to Disney World or go to a wedding with 200 people.
Which just reopened.
Getting married and,
Yeah.
You have a 50-person wedding and they have to stand 6 feet apart and wear masks. It doesn't sound real exciting to me. Okay.
No, I know. I'm going to a wedding tomorrow, impromptu, because they canceled the big October wedding, and instead they're just going to have a little gathering, on a bridge over a river with just a handful of people, because they can't say for sure, when it's going to change. So let me just rephrase the question, because obviously, like you said, you can't necessarily see the end of the rainbow. But what is there anything that, having now spent the last 4 or 5 months entrenched in this, is there anything going back all the way back to March that you would have done any differently? I mean, and that could be something as simple as, boy, I wish the heck, we were staffed differently or better, or wish, is there anything that because as this changes day to day, that you wish you had a crystal ball and had seen where we'd be come July?
Well, 2 things. Well, first of all, the Pompano Health District probably could have used another additional 1 or 2 staff people. The vast resources that came into the state of Connecticut from all the federal grants, and then came into the state health department from all the federal grants, a very, very, very minute amount that they give to the local health departments in Connecticut. They have kept 98.5% of it at the state level. What is surprising is the massive amount they kept at the state level. Okay. So in some levels, the response to this has been another giant unfunded mandate onto the local towns like Southbury, Woodbury, and Oxford, and then onto the local health departments, where the state health department just got bigger and bigger and bigger with hiring people galore with all this federal money, where we're basically, they gave us like $3,000 a month, and it's now exhausted. And that's just shocking. And there's no one really to complain to. And if you complain too much, they'll make it less. And so we probably could have used additional staff. And if there was one other thing, what happened into the nursing homes and into the nursing homes across the state and into the nursing homes in Southbury, Connecticut was a horrible thing and could have been stopped. And the state could have stopped it. And the nursing homes could have stopped it. And the system could have stopped it. And some did. Southbury, Connecticut, we have River Glen with 1 or 2 cases, and Lutheran Home with 70 cases, both 130-bed nursing homes 2 miles apart. One basically did stop it, one did not. And the state had a role in that. And for a month, the state employees were hunkered down doing FaceTime inspections of nursing homes. It's a true story. Not right. Okay? 32 years, I'm opinionated, okay? So.
Well, no, that's why I have you on here, and I appreciate you taking time. And I know it's been a crazy, 5 months for everybody. But I know how much in the trenches you are, so I appreciate you taking the time to talk to us today. Okay. I'm going to, with that, I'm going to go back to my screen and show everyone your contact information. Hold on 1 second, everybody, while I try to do that. And we have it here. Okay, so there is Neil and my contact information. I'll leave that up for a couple seconds. Anybody that wants to reach out.
Call me anytime. My cell phone number, which isn't there, but it's 203-907-9165. And I basically do this 12 hours a day, 7 days a week, really. Yeah. It's a never ending, and it's fine. But so call me anytime, Saturdays and Sundays included, and we'll get you answers to the questions. And I'm going to go. Stay tuned for the schools opening and closing, or half opening and half closing in Southbury, Connecticut, Region 15 schools. Okay, I'm going to sign off, okay?
Okay, I'll let you go, Neil. I'm just going to tell everybody a couple things after you leave. Okay, I won't talk about you, I promise.
How do I leave? I'm hitting leave. Leave.
All right. So everyone that's still on the line there, I said, is Neil's contact information. I will be sending out my usual one sheet after this webinar to those that participated with anything we talked about as far as links, and including I'll throw Neil's cell phone up there with his, since he just gave us permission to use it, and then some upcoming topics. We may take a short break from the webinar series as we get towards the end of July, but coming up shortly, we'll be scheduling topics on education and workforce training, marketing and pivoting, human resources and legal issues, and technology and digital literacy. And if you have an idea for a topic that you'd like to have us cover, please shoot me an email, and I'd be happy to find some subject matter experts to talk with me, and we will cover it. But for today, this was our topic. And again, my thanks go to Neil, our Director of Health, for joining me, and to all of you for joining me today. I hope you have a safe and wonderful afternoon.